A very good morning. This is your Dr. Vinay, surgical gastroenterologist from Hyderabad. Let us examine the treatment options that are being tried out against the COVID-19. Initial days, we heard a lot about chloroquine, hydroxychloroquine, and then we've heard about antiviral drug called Remdesivir. Remdesivir is a drug which was used effectively against the Ebola virus. And now the plasma transfusion is being tried out. So all these, let me tell you, are still at an experimental stage. Large numbers have not yet been tested. And until large numbers have been tested and it has been concluded that the complications are very low, but the benefits are very high. The risk is low, but the benefit is high. Only then it will be officially announced that this particular methodology is the best way to treat coronavirus. So it is still completely at an experimental stage. Let us talk about plasma therapy right now. Now, what exactly is a plasma? The blood has two components. It has a cellular component, which is red blood cells, white blood cells, and platelets. Also, it has a fluid component. Those are the solid things. There is a fluid component. The fluid component, the fluid part, is the plasma. The plasma has clotting factors, which whenever we have an injury, they immediately stop bleeding, blood from flowing out. And then they also have antibodies. Now, what exactly are these antibodies? Antibodies are defense mechanisms produced by the body, sort of soldiers, against any external attack on the body. It could be any sort of attack. It could be common flu, it could be malaria, it could be typhoid, it could be any viral fever. Against this, the body immune mechanism produces what is known as the antibody. The one which attacks us is known as the antigen from outside. And this antigen, when it enters into the blood, in this case the coronavirus, then against that, antibodies are produced to fight with it. That is known as the antigen-antibody reaction. They both fight with each other. And whichever wins is successful. If the antigen wins over the antibody, then the symptoms like fever and things like that come in. If the antibody wins, then it stops at an initial stage itself. So the antibody is not general. It is very, very specific against that disease. A malaria disease has specific antibodies. Typhoid has specific antibodies. Similarly, this coronavirus has very specific antibodies against it. So, the plasma of a person who has recovered from the COVID-19 disease, who has after recovery tested negative, his plasma is taken, hoping that the antibodies which come along with that plasma, when it is transfused into a person who has just got tested positive for this coronavirus, his own antibodies which are produced plus the antibodies which are being transfused will fight against the disease and win over it. That is the hope with which this plasma transfusion is being done. As I said, it is still in an early stage, but specifically they will test the blood to see that there is no other disease in the person from whom the blood is being drawn. Because there are lot of infections like malaria, typhoid, which may be in the blood of that person. That person is a carrier, but they don't affect him until his immunity goes down. They test for those sort of diseases to see that, because if they don't test properly and transfuse it to a person who has got coronavirus, then they are giving him a new disease in addition to what he has already. They may give him malaria in addition to the coronavirus which he already has. So they test that, separate out the plasma and then transfuse into this person's blood, hoping that it will help him fight the external disease. But as I said, it's still at an experimental stage because they have to see how much plasma has to be given. He should not be overloaded with the plasma. A lot of things, it's still at an experimental stage, but let us hope that they come out successful. Thank you so much.